Alright, so this is JB, who is a 75-year-old female on hospital day 3 with sepsis secondary to right lower lobe pneumonia. She's a very pleasant woman who works as a carpenter. She showed me this cabin that she made. It was so awesome. The woodwork was just amazing.
Look, I don't care about the cabinet.
Okay, anyway, she initially presented with fever, hypoxemia, tachycardia, and altered mental status. We stabilized her, did a full sepsis workup, and started her an IV levaquin, zosyn, and vancomycin. We had a little scuffle amongst the team whether or not she needed dual coverage for Pseudomonas, but we made the medical student do some research, but he couldn't find anything. What a fail student. Oh, anyway, we just played it safe and did dual coverage. That's what I learned in medical school too.
Move on.
So moving along, she was transferred to the ICU on a ventilator without pressors and quickly turned around. Today her blood and sputum cultures grew Streptococcus pneumonia, so we de-escalated her antibiotics to just IV ceftriaxone. I got a lot of pushback from the patient about using ceftriaxone on her. She said she got cephalexin before and she maybe got hives from it, but nothing really serious from it. It took a lot of convincing to get her on board with the ceftriaxone, but she did totally fine after her first dose. She can be such a princess sometimes.
Is this really important for nighttime coverage?
I guess not. So today she's afebrile, satting 98% on 3 liters of nasal cannula, but continues to be tachycardic in the 110s and short of breath on exertion. She had some crackles in her right lower lobe, but the rest of her lung fields were clear to auscultation with no wheezes. She was tachycardic on exam, but her S1 and S2 were normal with no murmurs, rubs, or gallops. Her lower extremity exam was normal with no palpable cords and negative for Hohenstein. We ordered a chest CTP protocol and pre-treated her with IV fluids due to her AKI, but the final read on that is pending. Man, radiology always takes forever, don't you think? They just sit in their $3,000 chairs, sipping on their coffee, listening to iTunes in the background. That's the life, man.
You know I'm prelim radiology, right? That's highly offensive. Let's just move on to the next patient.
Alright, so this is HC, who is a 35-year-old male with a perforated diverticulitis who is post-op day 1 for open colectomy with diverting colostomy and is currently in unstable condition. And just FYI, this is my first day in the surgical ICU and I'm feeling a little nervous. This is a sick guy, he's so young, we're almost the same age, and this could easily be me being rounded on right now. Isn't that crazy?
We all get nervous. Let's move on.
Sure. So he initially presented with an acute abdomen with fever and hypotension. He had an open colectomy with diverting colostomy and stabilized in the surgical ICU on a ventilator with pressor support of norepinephrine, epinephrine, and vasopressin. Sepsis workup was ordered and he was being covered with IV zosyn and vancomycin. He was weaned off of vasopressin today. His abdominal exam is much improved. Man, you should have seen this guy's abdomen, like textbook acute abdomen. Super rigid, guarding his stomach like a mother bear would guard her cubs, rebound every movement and bump on the road, causing discomfort. The works.
I don't need a lecture on acute abdomens. What else?
Okay. So we had some lab data today, and some pertinent ones include a sodium of 133, potassium 4.7, bicarb of 22, BUN of 50, creatinine of 1.2, white blood cell count of 18,000, hemoglobin 11.5, platelets of 250. The plan is to wean off epi today, follow up on the culture data, perform serial, abdominal, and wound exams. We'll keep the antibiotics on board because we're worried about sepsis with this continued need for pressors and leukocytosis. I would add IV levaquin for dual coverage for Pseudomonas if he worsens or develops a fever. I've seen some pretty nasty infections, man. I had this one patient with a stump infection of Pseudomonas, VRE, and MRSA. She had to be on tobramycin and daptomycin because she had end-stage renal disease on hemodialysis.
Yeah, that's totally irrelevant. Let's move on.